Welcome everyone. Thank you for joining Continuous Learning with Bioguard. It is my pleasure to introduce our webinar speaker, Dr. Jingwen Luo. Dr. Luo received her DVM, master degree, and PhD candidate in clinical veterinary medicine from the Nanjing Agricultural University in China. Currently, she is a specialist at Veterinary Ophthalmology and owner of Focal Pet Hospital, providing specialty ophthalmic service for small animals. She is also serving as the tutor for master's students at Nanjing Agricultural University. Dr. Luo will be exploring the diagnosis and treatment of uveitis in dogs through a case study in this webinar. The presentation will cover clinical science, diagnostic approaches, and therapeutic strategies for managing this condition. We are excited to have Dr. Luo as the speaker for this webinar. Without further ado, let's welcome Dr. Luo.
This presentation via webinar. And tonight, I'd like to share you some useful experience about canine uveitis. Before starting the lecture, I'd like to introduce myself. My name is Jingwen Luo. I'm from China. I have been a veterinary ophthalmologist for more than 10 years, and I'm a PhD student at Nanjing Agricultural University, as well as a second tutor for postgraduate students. Thanks to Bioguard company for inviting me to give this speak, and you can scan their QR code to contact their staff. Okay, let's take a look at what we are going to share tonight. Firstly, we start with some information of the dog with uveitis. This is a real case. And then we summarize the common symptoms of canine uveitis. Secondly, we learn the diagnostic skills of uveitis and find out the potential causes that need to be explored. At the final part of my session, we summarize the treatment of uveitis, and I'd like to share you the outcome of this case. Okay. Before we go into the case information, let's first understand the incidence of canine and feline uveitis in ophthalmology clinics. The incidence of canine uveitis was 24.9%, and the incidence of feline uveitis was 24%. This means that uveitis is a common eye disease in both dogs and cats' eye disorders. So it's very important and necessary for us to learn how to diagnose and treat uveitis. Okay, now let's get right to look at this patient information. This is an Alaskan Malamute. His name is Wang Cai. He was 1 year and 3 months old, 40 kilogram intact male at the time of his visit. And his owner complained he was blind and had red eyes. The history was that 4 days before the visit, Wang Cai's conjunctival became congested. the eye condition worsened in the following days and becoming cloudy. He started bumping into things the day before his hospital visit. Both his energy and appetite had decreased over the past few days, and his eyes were not allowed to be touched. He had a fungal skin infection several months ago. However, there were no current skin infection symptoms at the time of his visit. So after knowing this information, this basic information, what should we do next as a vet? We need to create the list of problems. Then, what is the most important problem of one's eye? It should be blindness. The first and most important problem is blindness. What is the second problem? Red eyes. These two problems were what his owner complained. Remember that? So we need to rank these two problems ahead. Then, any other problems? Corneal opacity. It is said his cornea became cloudy, so we know that he also had corneal opacity. And exophthalmos. Did you notice that? If you didn't notice that, let's go back to the previous slide and look at this picture again. Have you seen that? Both eyes protrude from the sockets. So now we know that he also had exophthalmos. Any other problems? Don't forget, he also had eye pain. He didn't let the owner to touch his eyes. Finally, he was loss of energy and appetite. Actually, these are non-specific symptoms. And as there were no obvious abnormalities found during the physical examination, so we stay focused on the ocular symptoms. Then, what diseases could you think of that have all of these symptoms or a few of these symptoms? What diseases could you think of? The first one comes in mind should be glaucoma. Glaucoma could have all these 5 symptoms. When a dog has glaucoma, he may appear like blindness, red eyes, corneal opacity, exophthalmos, and eye pain. All of these 5 symptoms could happen when the eye had glaucoma. Any other diseases? A possible disease is uveitis. Except for exophthalmos, all the symptoms are consistent with uveitis. Blindness, red eyes, corneal opacity, and eye pain, all of these are consistent with uveitis. Actually, it is not quite accurate to say like this, because exophthalmos may also occur when secondary glaucoma is induced by uveitis. So the exophthalmos should also be considered a symptom of that related with uveitis. Uveitis actually could also have all of these 5 symptoms. Any other diseases? Corneal ulceration should not be ignored. Even though only 3 symptoms, the red eye, corneal opacity, and eye pain, only 3 symptoms are consistent with corneal ulceration. We still need to confirm or rule out this disease. So at this point, we also get the list of differential diagnosis, right? We have 3 kinds of diseases needed to differentiate. Okay, now let's take a look at the results of this dog of his ophthalmic examination. The malus response in both eyes were absent. The direct, indirect pupillary light reflex and dasal reflex were also absent. That means this dog was really blind. All of these vision-related tests were negative, so we know that he was blind. The values of Schirmer-Tear test in both eyes were normal. However, the values of intraocular pressure in both eyes were abnormal. We have already known that the normal range of intraocular pressure is 10 to 25 milliliter of mercury. So here, the pressure in the left eye was 44, while that in the right eye was 56. Both of them were higher than normal. So we know that, at this point we know that this dog had glaucoma. We can confirm that. And the result of corneal fluorescein staining were normal, indicating that there were no corneal ulceration. So at this point, we can also rule out corneal ulceration from the list of differential diagnoses. Then we just remain one disease, uveitis. We still don't know for sure if this dog had uveitis. Then how could it be diagnosed? How could the uveitis be diagnosed? We need to use slit lamp biomicroscope. Look at these pictures. We can observe the anterior chamber in the circular light from the slit lamp. So from this picture, what can we see? We can see conjunctival congestion, corneal opacity, corneal neovascularization, mydriasis, and those small black spots. They look suspending or stacking to some area, maybe corneal or anterior chamber, or the anterior capsule of the lens. So how could we know where exactly are these black spots? How could we know that? We need to use the slit light. The most important role of the slit lamp biomicroscope is to emit slit light. Let's look at this video. See it? From the video, this video shows us how to use the slit light to check the eye. So let's display the video again. You see, we use the slit light to check the eye. By using the slit light, we can determine the relative position of the cornea, the anterior chamber, the iris, the lens, and even the vitreous. So it's very important. Let's see it again. It's very important to use the slit light to check the relative position of the structures. Okay, now we used the slit light for this dog. We checked the eye, and we found the black spots were between cornea and iris. So we know that those black spots were in the anterior chamber. And we found that both eyes had those black spots. There were the keratic precipitates. This is one of the characteristic symptoms of the uveitis. So by this time, we can confirm that this dog had uveitis. And there is another characteristic symptom of the uveitis, that is aqueous flare. We can observe the aqueous flare by using a very small point light, just like here, the point light in these pictures. We can use a very small point light to check the eye to observe the aqueous flare. Actually, the aqueous flare is a kind of Tyndall effect. It appears the beam of light in the anterior chamber. Here, the beam of light. It should not be seen in a normal eye. This picture is from a normal eye. We can see the light point on the cornea, and then the light disappears in the anterior chamber, and then the light travels through the lens. So this is what a normal eye should be. But when the eye has aqueous flare, we see a light spot on the cornea and then continue with the beam of light in the anterior chamber. So this the phenomenon of aqueous flare. It is very important to know this phenomenon and to recognize it, because it is a very easy method to help us to diagnose the uveitis. It's very important. I hope I made this clear and easy to understand, because it is really very important, and I will emphasize this in the later of my session. Okay, up to this time, we still have a question. Why did this dog have exophthalmos? Why did this dog have exophthalmos? Is that because of the enlargement of the eyeball itself, or something like a mass or something pushing the eyeball from behind? We need to figure out this question. We performed the ultrasonography to make sure to figure out what happened. From the ultrasonography, we found that the corneas were thickened in both eyes. The depth of the anterior chamber was decreased in the right eye. OD is the right eye. OS is the left eye. So the anterior chamber, the depth of the anterior chamber was decreased in the right eye. And the lens were thinning in the right eye. Here, the lens were thinning in the right eye. How about the iris and the cerebral body? The iris and the cerebral bodies were thickened in both eyes. And we can see the linear aquagenic substance in the vitreous chamber in the right eye. Here, we can also see the local thickening here, the local thickening of the posterior wall of the left eye. This is the retinal edema, and this is the detached retina. So, and we also notice that the enlargement of both eyeballs. Here, the distance is the axial length of the eyeball. The normal axial length of the eyeball in this breed should be around 2.2 centimeter. But here, the length in the left eye was 2.32 centimeter, and that in the right eye was 2.49 centimeter. So we know that both eyes were enlarged. Okay, by this time, based on all of these ophthalmic examinations, all of these results. So, could you give the primary diagnosis based on all of the results of all of these ophthalmic examinations? Could you give the primary diagnosis? Let's try. The left eye had glaucoma, uveitis, and local retinal edema, and the right eye had glaucoma, uveitis, and local retinal detachment. So actually, all of the symptoms presented in this dog were due to uveitis, even the higher intraocular pressure, even the retinal detachment or edema. All of these symptoms were caused by uveitis. Then, however, uveitis can also cause other symptoms. So let's summarize the common clinical symptoms of uveitis. Before we talk about the symptoms, I'd like to briefly explain what is uvea. Look at this diagram. The orange-red area is the uvea, the orange-red area. It includes the iris in front, here the triangular ciliary body, and the entire posterior choroid. This is the uvea. If you look at the uvea, the whole uvea from the outside, it will look like this. This is the fully dissected uvea from a dog. If you look at the uvea from the inside, it will look like this picture. This is the sagittal plane view of the eyeball. Okay, let's get right to know the common clinical signs of uveitis. If a dog has uveitis, you may see conjunctival congested, look like here in the picture, and corneal edema. The cornea became thickened and become cloudy, semi-transparent. That means this cornea was edema. And hypopyon, you may encounter hypopyon. See here, the white sediment in the anterior chamber here, and fibrin exudate in the anterior chamber. This is very common in the cat. And sometimes you may see hyphema. The blood accumulates in the anterior chamber. And in these two pictures, we can also see the constricted pupil. The pupil constricted into very small shape. Constricted, that's meiosis. It's very common in when the eye has uveitis. And you may see posterior synechia of the iris. In this picture, the pupil was dilated to show you the position of the posterior synechia here. The iris adhered to the anterior capsule of the lens. Here, this is the posterior synechia. And sometimes you may encounter abnormal pupil shape, like in this picture. In this image, the irregular pupil is caused by this, the melanoma of the iris. And less often, posterior vitreous or retinal hemorrhage could be seen through the pupil. Here. So far, all of these symptoms I've just shown you can be observed directly in front of the eye. Right? We can see all of these symptoms. We can observe these symptoms just in front of the eye. Let's go back to the last slide. We can directly observe these symptoms. However, sometimes the symptoms occurred in posterior segment of the eye. We cannot observe it directly. Then how could we observe that? We need to use fundoscope, or we need to do the fundus examination. Then we may see the retinal edema, like in this picture. The whole retina, the whole fundus looked cloudy. The vitreous hemorrhage, some bleeding, blood here, and the serous retinal detachment. See here, in this image, the retina bulged like a bulla. Of course, we also can observe the detached retina by doing the ultrasonography, like in this picture. We also can observe the detached retina from the ultrasonography. Like here, the linear echogenic strain or substance here in the vitreous chamber. This is the detached retina. Meanwhile, we can also see the thickened iris and the ciliary body when the eye has uveitis. It is often seen, the thickened iris and the ciliary body when the eye has uveitis. So the ultrasonography is very important to know the exactly structure internal the eyeball. It's very important. Okay, at the end of my summary of the symptoms of uveitis, I'd like to emphasize aqueous flare again. Aqueous flare is the pathognomonic symptom of uveitis. We can observe it by using the slit light here, by using the slit light, or a very small point light. If you don't have the slit lamp biomicroscope, any tools that could emit very small, like here, very small point light will work. So if you observe this phenomenon, you can diagnose uveitis. So it's very important to remember this. Okay, let's go back to the slide of primary diagnosis. Now we have known that the dog had glaucoma, uveitis, and local retinal edema or detachment. What should we do next? Should we go into the treatment procedure, or should we ask ourselves a question? Is this the final diagnosis? Of course not. After diagnosing uveitis, we need to figure out, is there any underlying diseases? Here, I summarize the common causes of canine uveitis. The probability of each cause is indicated in the parentheses here. Interestingly, a significant portion of uveitis is of unknown etiology. The possibility is about 40%. That's very high. And some of the uveitis may be due to autoimmunity problems, like lens-induced uveitis. When there is cataract or the lens capsule ruptured, this will happen. Lens-induced uveitis. And Vogt-Koyanagi-Harada syndrome. Actually, Akita is the breed with high predisposition. Akita is the breed that is the predisposed breed of this disease. As for the infectious diseases, the pathogen include Ehrlichia, Toxoplasma, Brucella, Canine adenovirus, Canine distemper virus, Leishmania, mycotic, leptospiral, mycobacterium, and parasites. The most common neoplasia that cause uveitis is lymphoma in dogs. And less often you may encounter the uveitis that is caused by hyperlipidemia, less often. So now we know that there are so many underlying diseases that could cause uveitis. Then to explore the underlying causes of uveitis, to explore the underlying disease. In addition to do the ophthalmic examinations, what else should we do? We also need to do some further diagnostic procedure. First of all, we need to establish the minimum database, like cell blood count, serum biochemistry, urinalysis, urine culture, systolic blood pressure. The second, we also need to do abdominal ultrasonography, chest X-ray, radiography. And thirdly, if there are enlarged lymph nodes or masses, we may also need to do cytology or histopathology. Complementary tests are often be done to detect the underlying pathogens or other reasons, like serological or PCR screening for related infectious diseases, or advanced imaging techniques like CT, MRI. At last, if necessary, we may also need to do iris biopsy, paracentesis of anterior chamber, hyaluronicis. This is the paracentesis of vitreous chamber, subretinal aspiration. However, we need to know that even after a thorough examination, approximately 40% of cases cannot be attributed to a specific causes. We need to know there are approximately 40% cases could not find the underlying reason. Okay, Let's continue with the results of this dog, of this case. The result of his cell blood count were normal, and the result of the serum biochemistry showed mild elevated cholesterol level and slightly reduced amylase and bilirubin levels. These changes were not directly related to uveitis. Okay, the serum level of CRP was a little higher than normal. And we also did the PCR tests. The PCR screening for related infectious diseases that included Toxoplasma, leptospiral, Ehrlichia, Anaplasma, Mycoplasma, Barania. Each result of them were negative. Here, they were negative. We didn't find the underlying disease here. By the way, the Bioguard company has the Q-mini real-time PCR equipment and mini-chain veterinary coagulation and chemistry combo analyzer. With these devices, it will be very convenient to detect in your hospital. So if you are interested in these devices, you can contact with their staff to know more information. Okay, let's continue with our topic. Unfortunately, the owner refused to undergo any further tests. So at last, we still didn't know the exactly reason of his uveitis, and there were no specific cause had been found in this case. Okay, let's move on to the therapeutic procedure. The goals of the treatment of uveitis is to control inflammation, to control pain, to minimize secondary complications, and to return vision if possible. How to do that? Methods include etiological treatment and symptomatic treatment. As for the etiological treatment, here this table shows the pathogen and its corresponding therapeutic drugs. If there is Ehrlichia, I mean the underlying disease, maybe we need to use doxycycline. If there is Toxoplasma gondii, we may use clindamycin. As for the symptomatic treatment, basically, we need to use topical anti-inflammatory drugs, include corticosteroids and NSAIDs. We may use cortisone acetate, dexamethasone, sodium phosphate, diclofenac, pranoprofen. These medicines are available in China. What need reminds that here, what it needs reminds here, if the cornea shows fluorescent staining or indicates an infectious disease, it is not recommended to use corticosteroid. We need to know that here. We need to be careful to use the medicine. And if it is a moderate or a severe uveitis, we may also use systemic anti-inflammatory drugs like prednisolone, methylprednisolone, or meloxicam, ferrocoxib. It should be noted that systemic corticosteroids and NSAIDs could not be used together. Of course, at this point, we need to be very careful to use these medicines. We also need drugs to prevent complications. We need topical mydriatic or cycloplegic drug to decrease risk of syncytial formation, like tropicamide or atropine. We may also use topical carbonic anhydrase inhibitors like dorzolamide or brinzolamide to prevent secondary glaucoma or timolol. If the dog is in pain, we may also need analgesic drug, butorphanol, morphine, 8-sectorol. Okay, so for this dog, for the present case, what's the treatment for him? We use topical medicine. Here, we gave him tobramycin dexamethasone 4 to 6 times a day for both eyes, brinzolamide and timolol 3 times a day, both eyes, and sodium hyaluronate eye drops to protect the cornea 2 times per day. We also gave him the systemic oral medicine, amoxicillin clavulanate potassium for 3 weeks, and doxycycline for 3 weeks. Even though we didn't find any underlying disease, because the level of CRP was a little higher than normal, and the appearance, do you remember some black spots in the anterior chamber? So that still led me to worry about there was any underlying disease. So I still gave him the antibiotics and prednisolone for more than 1 month. Okay, and 4 months later, this dog returned to have a recheck. Look at this picture. This picture was taken at the time of his recheck. Here is the dictation of his owner. His owner said, now the dog has sufficient vision to lead a normal life. He only gave the dog topical medicine for the right eye twice a day, and currently the left eye is in good condition, but the right eye often has conjunctival congestion. Okay. So we performed the ophthalmic examination for this dog. We found that his left eye has regained vision. The balance response was normal. The pupillary light reflex, direct or indirect, and doesn't reflect all of this. Vision-related tests were normal. So we know that his left eye has regained vision, but not in his right eye. Here, the balance response was still abnormal. Here. And the intraocular pressure in both eyes were maintained in normal range. That's good. Okay, let's look at these pictures of his both eyes. The left eye looks okay, it's normal, but the right eye looked abnormal. We can see conjunctival congestion here and semi-transparent corneal. The whole cornea looks cloudy. And we still see the mydriasis and vitreous hemorrhage through the pupil. We also did the fundus examination this time. We found that extensive here, also in the right eye, extensive pigmentation in both fundus. And the whole fundus of the right eye looked cloudy. And from the ultrasonography, we can also see the detached retinal and enlarged eyeball. Here, can you see the axial length of the eyeball was 2.43 centimeter. So it's enlarged in the right eye. So by this time, we concluded that the right eye has refractory chronic uveitis. Now, what is the recommendation? Should we give the owner? We need to know that, and we also need to let the owner to understand that if the eyes do not improve, remain painful, develop secondary glaucoma that does not respond to therapy, and are irreversibly blind, or if there is an intraocular tumor, enucleation is an appropriate treatment. So for this dog, it is recommended to consider either an enucleation or a transscleral prosthesis surgery for the right eye. But the owner just wants to maintain the status quo, so he keeps to use the medicine as before. These 3 kinds of medicines, both twice a day for the right eye. This is the outcome of the case. Okay, that's all for tonight. That's all for the lecture. If you have any question, please let me know. You can type the question in the dialogue type box. Thank you for your attention. I saw some questions here, and I'd like to answer them. And the first question, The first question is please tell the differentiation between neovascularization and corneal congestion on exam. Is this the first question? I need to answer this. Actually, neovascularization is the new blood vessel that grow onto the cornea. Actually, cornea itself don't have any vessel, right? It's this structure, the cornea, doesn't has any vessel on the cornea. So when we said the new vascularization, it means the cornea, there are some new growth blood vessel on the cornea. So if you say the corneal congestion, actually we never say that. We always say the cornea has new vascularization. And if you want to recognize or to differentiate the new vascularization and corneal congestion, that's a different concept. Corneal congestion, I think you need to see the vessel on cornea. You need to see the new vascularization first. That's a cause. And then the effect is congestion. So that's the cause and effect. The cornea need to have the vessel first, and then you can see the congestion on cornea. So actually, we never say corneal congestion. We just say the cornea has new vascularization. Did I make this clear to understand? I hope that. And if you have any further question, please let me know. And now I answer the second one. Here. Oh, the second question, I don't understand it. What does this mean? It's not English look like. Sorry, could you type your answer, type your question in English? Then we skip to the next one. Will conjunctival congestion be always associated with uveitis and glaucoma? Or are there any more things to look up for? Yes. Actually, conjunctival congestion occurs in almost every kind of eye disease. So every time when you see the conjunctival congestion, that means this eye has problem. But what kind of disease do this eye have? Then we need to check. We need to make sure what's the structure have problem in the eye. So we need to do many examinations to make sure to know the exactly position of the problem. When the eye has conjunctivitis, the corneal diseases like ulceration or some non-ulceration problem, or the uveitis or the glaucoma, all of these diseases, then the conjunctival will appear congestion. So every time when you see this phenomenon, you need to do many examinations to know where exactly the problem is. Okay. Autologous ophthalmic serum is not indicated. Thanks. Autologous. Autologous. I understand your question. Actually, the auto serum eye drop will help. It's very helpful when we treat corneal ulceration, all the dry eye. I mean the keratoconjunctival cica. When we treat this kind of disease, the corneal disease, it will be very helpful. But when we treat uveitis or glaucoma, auto serum eye drop cannot give much help to treat this kind of disease. So when we treat uveitis, normally we don't use auto serum eye drop. Basically, we need to use anti-inflammatory drug. Can you explain why in this case the dog has mydriasis, while a common sign of uveitis is miosis? Yes, that's a good question. I'm so exact. I'm so glad you can ask this question. Actually, did you remember the diagnosis of this dog? His eyes had glaucoma. Of course, when the eye with uveitis, most time it should be miosis. But when the uveitis caused a secondary glaucoma, so the intraocular pressure is very high, and the secondary glaucoma will cause mydriasis. Do you use stem cell treating uveitis? Oh, no, I have no idea about this. I don't have the experience to use a stem cell to treat uveitis. Sorry. What is the best treatment for uveitis in dogs? This is a difficult question. What's the best treatment? I think for the uveitis, basically we need to use medicine to control the inflammation, to use anti-inflammatory drugs. That's the basic step we need to do. But how to give a best treatment? I think it's a combined we need to combine several direction medicine to control the uveitis. The basic medicine is anti-inflammatory drug, and we also need to use medicine to prevent secondary glaucoma, or to prevent the posterior synechia, and we need drugs to control the analgesic drugs to control pain. So we need to combine all these medicine together to give the best treatment. Okay. Did I answer all the questions? If I missed some question, please type the question again. Let me know. Why do you suspect this dog have glaucoma first and follow with uveitis? I think the dog have uveitis first. Yes, you are right. You are right. This dog this dog had uveitis first, then have the secondary glaucoma, not the glaucoma first and then uveitis. You are right. How do I know that? Because I use the medicine focused on uveitis, then the intraocular pressure was controlled in normal range. This is the first reason. The second reason is when the glaucoma was caused by uveitis, you will see a very significant symptom of uveitis, and just with the higher pressure, higher intraocular pressure. But if the glaucoma first and the secondary uveitis, you will see a very higher intraocular pressure and very slight symptom of uveitis. So that's different. The cause and effect relationship. We need to make sure, or we need to try to figure out which one is the primary disease and which is the secondary disease. In this case, this dog, he had the uveitis first and then a secondary glaucoma. So you have got the point. You're right. Are intraconjunctival corticosteroid appropriate in this case? Intraconjunctival, yes, of course you can use. You can give the intraconjunctival corticosteroid. Sometimes I may use dexamethasone to inject intraconjunctival sometimes, but that depends. Most time we don't need to use that method. If you want, you can try. Okay. Have any other questions? I think I have answered all the questions. If I missed them once, please type the question again. Okay. Is it okay if we give topical steroid and systemic? Of course, we can combine topical steroid and systemic together. We also can use two kinds of anti-inflammatory drug, the steroid and NSAIDs together, topical medicine. But I mean topical medicine, not the systemic. You also can use topical anti-inflammatory drugs with systemic steroid. That's okay, but you cannot use two kinds of systemic anti-inflammatory together. Okay.
And okay, thank you. And thank you, everyone. And good night.
Okay, thank you.